We have another story because millions of couples deal with infertility. To say it's challenging, that's an understatement. If the emotional roller coaster weren't enough, new research suggests men dealing with infertility also may face a greater risk of prostate cancer.
Researchers from Sweden's Lund University studied more than 1 million men and found those with male factor infertility are more likely to develop aggressive early onset prostate cancer. Scientists compared those who conceived with ICSI, intracytoplasmic sperm injection, with those who used IVF and those who conceived naturally. The men who had ICSI, commonly used to treat male infertility, showed a significantly higher risk of prostate cancer and 3 times the risk of being diagnosed with prostate cancer before age 50. Researchers don't blame the fertility treatment for the increased risk, but rather suspect an association between the cause of the man's infertility, like hormonal imbalances or yet to be detected tumors, with prostate cancer. The study suggests fertility could be a powerful screening tool in the fight against prostate cancer.
Dr. Spitz, I'll just throw this to you. What are your thoughts on this?
Sperm count and prostate both fall under the influence of hormones, primarily testosterone. And men with infertility often have lower than normal levels of testosterone, and often they're given hormones to boost it. So over their lives, they may have abnormal levels of testosterone and other hormones for that matter, and this may be playing a role in the development of prostate cancer as well for some of these men. On the other hand, a lot of times men who are infertile really don't get a proper evaluation. If they have enough sperm for the ICSI procedure, they're usually just left at that. They're kind of like sperm donors, but no further evaluation is given. When they do come under evaluation, it turns out that a higher incidence of prostate cancer is being detected. And maybe it's because these men are now being watched more closely that we're seeing this greater amount of prostate cancer. But it speaks to the fact that infertile men ought to be evaluated completely and properly and not let the technology of ICSI stand as a substitute for a good evaluation.
So you might think that this is actually that they have undiagnosed prostate tumors driving their infertility. So maybe infertility should drive or trigger a screen, basically.
That's right. When we see a problem with one part of the body, let's not forget that it could be a reflection of a larger problem involving other parts of the body or the whole body. So rather than saying, hey, this guy has low sperm count, but that's not life-threatening, as long as we can get the sperm, we're okay, take a step back and say, well, this might be a reflection of a larger picture, and let's evaluate this guy properly. So, you know, women, if your guy has low sperm count, but you're able to make the baby, don't stop there. Make sure he gets sent on for a proper evaluation, because after all, you want him to be a dad for a long time.
It's a really great point, and I think the takeaway here is that infertility can be a sign of other systemic issues, and there's more to learn on this, but if you do have an issue as a male with infertility, talk to your doctor. Hey, is there a potential for increased risk of prostate cancer? What other screening should we do?